All right, so tonight I'm on a telemetry floor, and that just means cardiac patients. So for right now, I have 4, but I can get up to 5. The 4 that I have, one is someone who came in with heart failure. All my patients are elderly. Oop, got a little fuzz on my face. But yeah, she's elderly and she has heart failure. I had another one who came in, excuse me, I'm just looking down at my papers. Another one who came in with a fever. But then he started having really low blood pressure. So that's why he's on our unit. And then my other one, we're doing a stroke rule out. She started having like some weakness to the right side of her face. But she says it was more associated with pain. Once the pain went away, the weakness went away. So right now on our stroke scale, she's a 0, but we're just monitoring her. And yeah, so she's doing all right. And then my other person came in with hypotension, which is low blood pressure. And we're thinking maybe it's just more related to her double dosing on her meds. She's a bit forgetful. So it's possible that she took her medicine twice. So those are the people that I have right now. I'm up for one more admission. There's a couple other nurses here and they only have 3 patients, so they'll probably get their admissions first before me, which kind of sucks because it means that I can end up getting admission like towards the very end of my shift, which sucks when you're super busy and then you have a new admit coming in, because doing a new admission takes at least an hour and a half to do. So yeah, so I'm just gonna go and chart on my people now. I passed all my meds, did all my assessments. It is about 9. What is that? About 9:45 at night. So I'm gonna go chart on my people and I'll be back. Okay, so I figured I'll show you what an empty room looks like. So here is our little computer cubby. Here's our scanner where we scan the patient's wristband before we give meds and do procedures. Here's the whiteboard. We put the date, the patient's preferred name. Yeah, nurse, the assistant doctor. We normally don't have a nursing assistant. Diet, activity means how they can move around, what goals we have. Get the TV, a little closet over there. This is one of our smallest rooms. This room is super small, but normally it's a bit bigger. We could fit a table, a couch. Bathroom, shower. Here's our monitor. And we would take their blood pressure, their pulse ox here. Yeah. So here are the fluids, and I've already primed my line. All right, so I already primed my line. Let me see if I can do this with one hand. So this piece, So my patient needs a heparin injection. So it comes in this little vial like this. And I'm gonna draw it out with one of these syringes, a blunt tip needle. These are not sharp. And then I'm gonna switch it right before I poke them with this little needle here. All right, so now I'm just gonna draw it up. Alcohol swab. And clean the top. Take my syringe. Take my blunt tip needle. I'm going to inject about a little bit of air. Push the air in and then pull the fluid out. And then I'm going to switch this needle out with this needle. And then when I get ready to give it to him, I'm going to push all that air out and then poke him. Let's see. Now I have a patient who came in for a fever, and these are the meds. So here they are here. For the metoprolol, that's for blood pressure, so I'll have to check the patient's blood pressure to make sure it's not too low, and then I can give that. We got gabapentin, which is used for like nerve pain. Some sodium bicarb. I'm not sure what this one's for. It's also called Sensipar, so I'll have to look that up and I'll let you guys know what that one was for. And then we have an antibiotic. Another name for this is Zosyn. So I'm gonna mix this up and I'll show you how I do that. Right now it just comes in a powder. Okay, so the order is to mix it in a 50 milliliter bag. So that's what I got. So I'm gonna take this off, clean the tip with an alcohol swab. Take this bag, I'm gonna take this off. The inside, you can see there's like a little pokey thing. I'm gonna spike it here. Sometimes this is a little hard to do. Got it in. Then I have to break it, so I'm gonna hear that. Then I'm gonna squeeze. See that going in there? Squeeze some fluid. Then I'm gonna shake this up. Sometimes it takes a while to get the antibiotic all mixed up. Super annoying. And then once I have it all mixed up, which is still like a big huge clump in there, you can't really tell, but once I get that mixed up, I'm gonna piggyback it or hang it off of his main fluids, and I'll use a piggyback tubing for that. Alright, so I'm gonna keep mixing, and then I'll give him his other meds as well. All right, so this is one of our supply rooms. Over here, there's like gloves, masks, gowns, bleach wipes, sanitizer. What is this? Suction catheter, all our respiratory stuff, suction tubing. This is a yanker, and you put this in down a person's throat, help suck up any phlegm. This is the canister where you hook this tubing onto. You hook it onto this. That's where all the spit and yuckiness go into. We have some chucks we put on the bed, just in case a person like pees or poops on themselves, they can catch it in this instead of going on the bed. Lancets. This is how we poke a person's finger to check their blood sugar. We take this gray cap off, and there's a needle inside of here, and then we press this part, and it will stick the person's finger. Emesis basin, bedpans. That's what we lay a person on. So this is a hat. Call these a hat. We put it on the toilet to catch urine, so we can test it. Patient belonging bags, urinals for the guys, more equipment. This is all respiratory stuff, humidifiers, oxygen tubing. We call these things Christmas trees. That's what we hook the oxygen tubing onto. Specimen cups for urine, phlegm, poop, all that fun stuff. Tubes to put blood and such into. More supplies, alcohol wipes, tape, gauze, all stuff to do wound care. Emesis bags, so people can throw up in them. MRSA swabs. We stick that in the person's nose. Check for MRSA. More supplies. Over here we have a warmer for like our washcloths. So when we wipe a person's butt, we don't wipe them with cold ones. We put them here in the warmer. And all the ones that are flashing, it says take first. Yeah, and then all the ones that are green, they're all green, so they're all ready to come out. And when we take one out, we put another one back in. Over here we have our blanket warmer. It's supposed to be at 130 degrees, which it is, and it keeps our blankets warm, just in case somebody needs a warm blanket. Extra commode, more supplies, bedding, pillowcases, draw sheets, top sheet, fitted sheet, blankets down there, gowns. These are the gowns for our bigger patients, and these are gowns for regular size. Towels. It's a bit messy. This is supposed to be down like that. All right, so that's our supply room. This is a small one. This unit's kind of small. Oh, and right here is where we put our needles. These are clean. There's nothing in there. All right, this is one of our med rooms here. This one's small as well. It's a small unit. So we have different type of fluids. Most common one is this one, normal saline. tubing piggyback for nitrogen. Nitrogen will be blue. Blood tubing, the packaging will be red. Stickers to label the tubing when we're supposed to change them out. We've got needles to start IVs. I like to use 20s. I hate when people use 22s on adults because they don't last that long. Insulin syringes, blue caps to go on top of your tubing, keep out bacteria. These are stoppers. When you stop an IV fluid, you can put that at the end of it. Keep it clean. More tubes for blood. These go on top of our insulin pens. These are needles. Flushes. We always carry these. It's just normal saline. I always have a bunch in my pocket. Syringes. These are 10 cc's. We use a lot of 10 cc's and a lot of 3. Some 5s. Here's some blunt tip needles so we can draw out medicine out of our little vials. Bunch of needles, pill crushers, plastic medicine cups, container with our new meds. Down here, so we put patients' med drawers. And here's just more stock stuff. This is the Omnicell, where we get all our medicine. Comes out of here and comes out of here. Yeah, so that's a vein finder. Is that a vein finder? No, that is a bladder scanner. People who don't urinate, if we need to check their bladder, we use this like an ultrasound machine, kind of. You put some gel on their belly and then scan to see how much urine they're retaining, and if it's a lot, then we would straight cath them or put a Foley catheter in. This is the vein finder here. Okay. Immersion. I don't think, okay, there it is. And it helps you find veins so you can poke people. See that? I got good veins. I got good veins. All right, I'm gonna go out and finish working.